Hi, this is Paul Stubenbordt with Denali Creative, and today we're talking about something that's pretty near and dear to my heart, which is phone training for ophthalmology practices, especially practices that are doing refractive surgery such as LASIK, PRK, EVO ICL, refractive lens exchange, or practices that are doing cataract surgery with premium lens upgrades or any type of elective procedure your practice might be offering. So a little bit about me. I've been in ophthalmology since 2001. It's been a long time now, about 25 years. And one of the things that I started my particular career out of was answering the telephone. I answered the phone for one of the busiest LASIK practices in the country. When I say busiest, it was really busy. We were doing somewhere between 800 and 1,200 LASIK cases a month with one surgeon, two optometrists, and a bunch of support staff, including the people that answered the phone. It was my first experience working in an ophthalmology practice. Started on the telephone, worked my way up to a counselor, and then I became a marketing consultant later on. So our business pretty much focuses on creating a foundation for practices, which include the telephone, sales skills. And today we're going to focus just on the telephone. After we have a foundation that's solid, we move on to marketing such as search engine optimization, answer engine optimization with AI that we have today, Google ads, social media ads, and more. But before we do that, we have to make sure that we do a great job on telephone. So let me click through the slides here. So why phone training really matters. Let me put on my glasses. Now, why would I need to put on my glasses? Because I have presbyopia, which means I think literally old eyes. So why phone training matters is really because we want to refresh the good habits we have. We want everybody to be consistent in how they answer the phone. It's just like if you walk into Chick-fil-A, you're going to get the same, instead of somebody saying, no problem, you're going to hear, it's my pleasure. We want the same type of consistency in our practice. It helps us increase conversion. So the better we do on the phone, the better we do at increasing patient conversion. And that means when a new patient calls in, that we're able to convert that patient to an appointment. And it protects our marketing return on investment. We'll talk about that in this slide. So what does it cost when you miss a call? Well, we don't do a lot of marketing right now, but we do spend a lot of time with optometric and PCP co-management relationships or referral relationships. So you can pretend that every call has literally $4,000 to $10,000 sitting on it every time we pick it up and convert it to a new patient, because that's what every new cataract patient that upgrades to a premium lens is worth. It's also what a LASIK patient might be worth. So right now in our practice, we are missing somewhere between 12 and 14% of all new calls. Every inbound call that comes in, we're missing between 12 and 14% of all of them. We're just not picking up the phone. That's step number one. We got to pick up the phone. I worked for a practice that I was telling you about earlier, and my first hour I was working there, the doctor came back and he put $200 on top of the phone, just like in this example here. And I said, a bonus already? Well, thanks, Dr. Booth. And he said, that ain't a dang bonus. That's what it costs just to make the phone ring from marketing. So you better not screw it up. And then he put $4,000 on top of the phone. And that was, I thought, a bigger bonus. Turns out he was just trying to show another example, which is how much every phone call is worth. So every time you answer the phone, just imagine how much every call is worth. Plus, we're helping change lives because people are getting the vision they deserve. The four goals of every call is to make the caller feel heard. You want people to hear you when you're talking to them, especially like a doctor's office. I just heard the statistic the other day that the average doctor's appointment takes more than 2 months to get scheduled, especially for a practice that is that specializes like dermatology, ophthalmology, and the doctor spends less than 14 minutes with that patient. That's incredible. So 2 months for 14 minutes. So we want to do the best job we can to support our doctors and making sure the patient is heard, that we empathize with them, that we understand what their needs are. And that's really, really important. We want to identify the real reason that they're calling. So if somebody's calling in with a, underlying need, we might need to ask more questions. We need to route their call to the appropriate person. So if somebody calls in about an insurance question, the front desk should not be answering that question. It should be routed over to insurance or billing. If somebody's calling for a surgical evaluation, such as a LASIK evaluation, they need to be routed to one of our 2 surgical counselors. It's really, really important that you don't spend too much time in the initial call with them and you route them to the right person. And then more than anything else in this presentation, it's about converting calls. Number 1, picking up calls. Number 2 is converting new patients or doctor referrals into appointments. If there's nothing else you understand about this presentation, understand those 2 things. Pick up the phone and convert patients. You can never convert a patient unless you ask them to actually come in. So we'll talk a little bit about that a little bit later in this presentation. But the phone is the front door of our practice. It's the first human touch point a patient's ever going to have with us. The first impression is the website, but the first human touch point is when they actually call our practice. And it's something that they're going to, instantly judge us on how we do on the phone. If we don't answer the phone, it's a bad impression, first impression. And we only get one chance to make a first impression. If we are sounding distracted when we answer the call, they're going to hear that. They're going to say this place is spread too thin. Or number 3, they might call us and we put them on hold for 4 minutes. Now they're forgotten about. So you try to do your best so you can make an amazing first impression. And then referring doctors are always listening too. So referring doctors evaluate the responsiveness of how we answer the phone. Do we answer the phone? They get feedback from their patients on how we do with the telephone. The telephone is where it all starts. So the priority calls are going to be urgent clinical symptoms. You need to escalate those immediately. The patient typically will need to come in immediately for that appointment. We'll talk a little bit about what those appointments might look like. Referring doctors or primary care offices, for example, or optometrists or primary care physicians, they're a very high priority. We want to make sure that we prioritize those calls over billing questions or vendors calling us or somebody trying to reach their spouse at the office. It's a very high priority. And then next of the high priority calls is going to be new patients. So new patients, our job is to convert them into the practice. Existing patients, our job is to retain those patients and also get them back in for their appointments. Billing issues, we want to resolve any billing issues. We've all had billing issues with something, and nothing is more frustrating when we've called multiple times just to get the same answer. Weeks go by and nothing is resolved. So just do your best to put yourself in the patient's shoes so they know that you're doing your absolute best to help them resolve their problem. And then vendors or administrative calls, we route those to the appropriate people. Now, when we answer the phone, the standard greeting is going to be, thank you for calling, practice name. My name is Paul. How may I help you? Always say your practice name. Always give them your name and ask how you can help them. Everybody in the office should be using this standardized greeting. Answer speed really matters. So we want to have 2 rings maximum before we answer the phone. If something happens where the phone's just ringing and ringing and ringing, please make sure you step in and help somebody answer that call. Or if you have a patient in front of you, please ask the patient in front of you if they would mind just 1 second while you answer that call. It's really important. If it just rings and rings or the patient calls back, it's going to give a terrible first impression. Worse, if it's a doctor referring a patient over and that patient's first impression of us is them not being able to reach us or having difficulty reaching us, that's going to get back to that referring doctor. And that referring doctor is going to say the same thing. They're spread a little thin. I'm going to find somebody new. We want to try to make sure we answer the phone within 2 rings. And that just really tells the patient that we're attentive, that we communicate well, and that we care about the first impression when they call in. Also, let them hear your smile. So when somebody's on the telephone and they're happy, you can tell. You can tell that they're going to try to help you. For example, I travel a lot. I'm on flights all the time. And if I get delayed and I call American Airlines to try to get somebody to help me reschedule my flight, I can tell in that person's voice if they care or they don't care. If they don't care, I hang up until I get somebody in Dallas or somebody that's trying to help me get home. I want the person that's going to be like, thank you for calling American Airlines. How can I help you? That's what I want. I don't want the person saying, thank you for calling American Airlines. How can I help you? I can just tell there's absolutely no care in the world for that person. So if you let them hear your smile, it shows that you care. It shows that you can listen to their problems and help them solve their problems, whatever that problem might be. It also helps them lower their anxiety. A lot of patients are really scared when they call to the practice, and they're nervous and they need help. It helps lower their anxiety level. And if you're energetic at the office and you're polite at the office and you do a great job answering the phone, your smile's coming through the phone, all of your other team members are going to basically catch the sneeze. You know how a sneeze is contagious or yawning is contagious? Sorry, it's yawning, not sneezing. That energy is going to be contagious as well. It's going to spread like wildfire. Everybody's going to step up to your level. So it's really important to let them hear your smile. When you're on the phone, the do's and don'ts, the do's, let them hear your smile. Speak clearly and at a measured pace. A good rule of thumb is to listen as much as they talk. Let them finish talking before you start talking. Be concise. Try not to waste their time. Try not to say things like, I don't know, that's not my job, or, please hold. You don't want any of that. We want to basically put our problems and put our work environment that's causing us issues into a little brown paper bag, and we want to focus on that patient being our number one priority. It's like Walt Disney said, you don't have to advertise. All I have to do is give my customers a great experience and they'll tell their friends. And it's very true on the phone. We want to listen very carefully when they're talking, because they may have a major problem, and to them, it's a huge problem. To us, we hear it all the time, so it's not as big of a deal, but we want to really listen to what they're saying. And we want to stay positive even when the call gets difficult. Even if somebody's complaining and calling you whatever names, you stay positive. Don't go down to their level and just get the caller through, their difficult time. Your difficult time is when they're on the phone, but don't let them see that get to you. You want to really own the call, take responsibility for the outcome. If you get off of a new patient call and you don't schedule the patient, you got to ask yourself, why did not that patient not schedule? We're going to be listening to calls. We're going to be reviewing calls, and we're going to be doing the same thing. Like, why didn't that patient schedule? Think about what you could have done better in that call to get the patient to come in for their initial appointment. It's really important that you have that mindset. What you don't want is you don't want to sound tired or bored or distracted. You don't want to mumble or, mutter your words. Just try to be as clear as you can on the telephone. Don't drift off into another topic. Or for me, I have ADD. I'm definitely a squirrel. Don't be that person. Be the person that's really focused on the patient. There's a really good story about, what's his name? It's Mr. Rogers. Mr. Rogers would have a conversation with somebody, and he would make them feel like they were the only person in the room. Ever seen Mr. Rogers? He just sounded like he was talking only to you, and it was really important for him to make that come through. Try not to interrupt the caller. Don't sound annoyed or impatient. That's really important. Just keep a calm levelness about your voice or amongst your conversation, and don't allow side conversations or background distractions. So, for example, if you're on the phone and somebody's asking you where you want to go to lunch or what do you want for lunch, they should know you're on a call and shouldn't interrupt you in the first place. But if they do, just raise your hand and signal that you're on a call and answer their question once you get off the call. Just try to listen again as much as you can. Don't interrupt the caller. Listen for their emotion in the call, not just facts. Often callers signal anxiety or urgency or frustration when they're talking. And sometimes we just don't pick up on it. Sometimes they're really scared. They need somebody to hold their hand, or they feel like they have an urgent matter. To them, it might be really urgent that they slept in their contact lenses, and they need to come in immediately because they're having pain. And we should get them in. We want to make sure that we clarify before responding. We don't want to say anything that could get us in trouble. We don't practice medicine over the telephone. Our goal is to get the patient in. If they ask us a medical question we absolutely don't know the answer to say that's a really good question. When you come in, our doctors are amazing, and they'll take all the time in the world to make sure your questions are answered. The caller, again, you should be talking about as much time as the caller. They should never feel that they're competing with you on the telephone. So don't try to, over talk or overstep on the patient or talk over the patient. Just really try to listen to them and get what they need done. Using their name throughout the conversation is a really big deal. If you say, thank you for calling, name of practice, this is Paul, how can I help you? And they say something like, yeah, I was calling about cataract surgery. I was told by my doctor I have cataracts. You can say, oh, absolutely. You definitely called the right place. Can I ask what your name is? It's Mary. Hey, Mary, how's your day going? It's wonderful. So, Mary, do you have a referring doctor that you currently work with, or a doctor, an optometrist that you currently see? I don't. Okay, no worries. So, Mary, let me ask you a question. What's your date of birth? And you just use their first name, and that makes the call feel really personalized. And it makes them feel like it's a one-on-one conversation versus you're trying to do several things at once. There's a book called How to Win Friends and Influence People, and he said it's the number one tip he would give all new people coming into customer service is to use somebody's name. Now, in some cases, somebody might be older and they don't like to be called by their first name. They might like to be called Mrs. Smith or Mr. Anderson, and that's fine. Just personalize the call by using their name. There's 3 different types of patients that call our practice. There's patients that call in, they're called the assured. These are patients that just want to schedule an appointment and get off the phone. That's me 99% of the time. I hate talking on the phone for long periods of time. I don't like a lot of small talk. I'm very busy. Just want to schedule an appointment and get going. If I do call a practice and they don't understand my pace of speaking and they're really slow and they're asking me how the weather is and did I have a great weekend, for me, I can understand their effort, but for me, it's annoying. So the assured patient is somebody that talks fast, somebody that's checking their watch. They just want to schedule the call. And then you have the accessors. These are the people that use AI, WebMD, and they basically think they're doctors and they have all the answers, and they're going to ask you a lot of questions like, what lenses do we use? How do we treat dry eye? What kind of laser do we use for LASIK? And that's why it's really important for you to educate yourself. We'll talk a little bit more about that, but this is where you can either answer the question or don't answer their question and say those are really good questions. I don't really know the answer to those, and I hate to mislead you, but when you come in, our doctors are the best. They're going to answer all of your questions and make sure that you leave here basically with all your questions answered. And then you have the anxious caller. And these patients are the ones that remember their parents' cataract surgery. They remember how invasive it was. They remember the stitches. They remember the sandbags from the 80s. Now it's their time. They're 70. They've been diagnosed with a cataract, and they're nervous. They don't like anybody touching their eyes. They definitely don't like any type of eye surgery. Could be their first surgery, especially men. Men, we didn't, go through childbirth, and it's sometimes the first procedure some men have. So they're anxious on the phone. When people are anxious, you can tell they're nervous over the phone. They usually have a lot of questions. They're kind of like an assessor, and you want to really lead with confidence. There's a slide in here that talks about absolutely, you definitely call the right place. I'll talk a little bit about that now. Let's say you have some weird disease, like in the movie Joe versus the Volcano, he has a brain cloud. We'll use that as an example. You call somebody that's a brain cloud specialist. You call their office, say, hey, I've been diagnosed with a brain cloud, which is a fictional diagnosis. And they say, okay, how can I help you? Do y'all treat that there? Yeah, we do. You can just sense that maybe it's not what they specialize in. But if you call that same practice and you said, hey, I've been diagnosed with a brain cloud, y'all treat those there, and that person says, absolutely, you definitely call the right place. And you go through personalizing the call, calling them by their first name, really listening to them, slowing down your pace of speech. It's really important for anxious patients because they are so nervous to even make the first call to our practice, and we don't want to blow it by just trying to get off the phone. Everybody in an ophthalmology practice, especially if you've been there for more than a year, you should know the basics. You should know what a cataract is. You should know what causes cataracts. You should know what a premium IOL is. You should know what a YAG laser is for secondary cataracts. You should know the difference between LASIK and PRK. You don't need to know what the acronym really stands for. Be great if you did, but you don't need to know those. You just need to know that LASIK is with a flap and visual recovery is almost instant. PRK, there's no flap, same visual outcomes. Oftentimes, boxers, pilots are going to get PRK because the corneal's structurally stronger, but there is a little bit of discomfort. Healing time can take up to, 5 or 7 days, but the discomfort usually goes away pretty quickly within a day or two. They say for laser-assisted in situ keratomileusis and photorefractive keratectomy, by the way. Funny story for another time on why you should learn those. You should know what glaucoma is. You should know what open-angle glaucoma is, the difference between keratoconus and dry eyes glasses. What's the difference between a MD and an OD and a DO? Those are all things you should know. Soon we'll be doing a new training class on Ophthalmology 101, 201, and 301, and we'll talk about some of these things. But if you don't know the answer to these right now and you ever just wonder, what's Guttata? Write it down, ask the doctor, one of the other staff members that have been there a long time, and you'll just be amazed that the more knowledge you get, the more confidence you're going to have, and that confidence is absolutely going to come through the telephone. Ophthalmology calls are very different. Again, vision anxiety is real. When people call in, they're worried about something. Could be little to us because we see it every day. It's just like watching a TV show like The Pit or ER. The ER doctors are like, but us consumers, we're watching it, it's like, oh my gosh. So when somebody calls in and they say, I have a floater, or I have cataracts, I'm really scared to have surgery, or I think I might have something in my eye, to them, it's a really big problem. And even though we know it's not, we want to treat it as such. We don't want to inflate their problem, but we want to make sure that we talk in a way that they know we care and that we're listening. Elderly patients or spouses calling, or on behalf of partners or young adults exploring elective vision correction, everybody's a little bit different. So the way we talk on the phone, just like the Assures, the Accessors, and the anxious age groups or various people calling are going to have different types of tones that we need to use or paces of speech that we use. So just, again, put yourself in the patient's shoes and do the best that you can. A good idea is to kind of match the patient's speech speed. So if somebody's speaking slowly, talk a little bit slower. If people are talking fast, typically that's an Assured, you talk fast. Don't get into the small talk. Let's see, informational versus urgent versus elective. Quickly identify whether they need, information or clinical escalation, or if they're just needing to schedule an appointment. You need to be able to recognize urgent clinical calls, such as they have sudden vision loss in both eyes, flashes and floaters, or shadow in their vision, severe eye pain, chemical exposure to the eye. So if they got something in the eye that could be detrimental, they need to come in right away. If they've had any type of eye trauma or physical injury, sometimes these do need to go to the emergency room. So sometimes the patient might be able to come into our office, and sometimes they need to go to an emergency room. One time we had somebody at a practice I worked at, somebody fell onto a rose bush and actually came into our office. Our front desk did a great job at triaging them. Unfortunately, the patient got there and they had basically a piece of the rose bush going up through their eye and into their brain. Obviously, we can't see them at a practice. They needed to go to a hospital. So do your best to triage the call And if it does in fact sound traumatic, they probably need to go to the ER. Just ask one of the doctors. If people have post-op pain that's unusual, or visual changes or nausea, they probably need to come in immediately. Or if they have any type of significant swelling or discharge, they probably need to come in immediately. Don't diagnose over the phone. You're not a doctor. Don't even suggest what they might have. Just tell them that they need to come in immediately. And don't delay. They need to come in as soon as they can get there. Okay, so let's talk a little bit about conversions now. So again, the real objective of this phone training session is to talk about converting a new patient call or a referring doctor's lead into an appointment. That's what this entire thing is about. So information is important, but scheduling is the objective of this training module. We want to be able to build trust on the call. We need to identify their need. We need to guide them forward, and we need to get them scheduled. That's the most important part. In sales, we use something called ABC, or always be closing. There's usually a video I show, but we are going to keep it pretty simple this time. On the video, it talks about basically the difference between somebody that's an order taker and somebody that's a closer. But in order to be a good person on the phone and close them, which means to get them in for an appointment, you really need to listen to the caller first. Build their trust, guide them into the next step, which is either an appointment or go into an emergency room, whatever it might be. Make sure you help be their guide. Always, always, always ask the patient to come in for an appointment, especially if they never have been to our office or calling around. They're telling you everything you need to know that they're a new patient. Always ask them to come in. So that could be something like, hi, I was just calling to see if y'all treat dry eye. Absolutely. You definitely called the right place. Can I get your name? It's Margaret. Hey, Margaret, have you been diagnosed with dry eye before? I have not, but I just think I might have dry eye. Well, the first step is let's get you in for an evaluation. Margaret, let me get your telephone number just in case we get disconnected. Always get their contact information. We've all been through a frustrating situation where we've been on a call, we've spent 20 minutes on the call, and it gets disconnected. And then you have to call back and speak to another person. If you get their contact number first, as soon as the call comes in and their name, if something happens to that call, you can call back the patient. And let me tell you, it's going to feel like, 5-star service to them. Oh, and the close is, let's get you in for an appointment. Let me get your name. Let me get your number. Do you have medical insurance? And then we're going to go into closed-ended questions here in a little bit. So again, questions that can help build a conversation or discover what they really need is, what are you hoping we can accomplish with today? Is not going to really be for us, but it opens the call of, what are your goals? This is really going to be more for the counselors. Are you calling about cataracts, LASIK, glaucoma, or something else? Have you had another doctor refer you to our practice? This is really important. The first two here, not so much for your particular practice. But if another doctor referred them and we don't put that into ModMed, when the patient comes in, it could get bypassed that they were even a referral. And then the referring doctor doesn't see them post-operatively, doesn't help in their co-managed care, doesn't get paid, and it can cause a really bad problem. So one of the first questions you should always ask is, do they have an eye doctor that they see on a regular basis? Or did somebody refer them to our office? One of the questions should be, how did you learn about our office? That referral source should always go into ModMed. It's going to be really important when we start doing marketing, spending money on marketing. We want to track the referral sources precisely. No guesswork. We don't want to say online. Online's a lot of things these days. We want to say Google, social media, Facebook, Instagram. They found us when they did a search on the internet. That's going to be Google. We want to be as precise as we can. We want to be able to create a great first impression. That's going to be answering the call quickly, use the approved greeting we talked about a little bit ago. Smile and sounds organized. Let them hear your smile and make them feel welcome. Absolutely. You definitely called the right place. And again, first impressions are first impressions. We never get a second one. When we put somebody on hold, which is inevitable, we get busy, we have to do what we need to do. We always ask their permission first. Hey, Jonathan, do you mind if I place you on a brief hold? This is after you got Jonathan's name and after you got Jonathan's number, just in case Jonathan gets disconnected. Always ask their permission and then explain why you need to put them on hold. Let me go ask the doctor. That's a really good question. Let me go ask the doctor, do you mind if I place you on a brief hold? You don't need to give them a time estimate. Say it should just be a moment or it should be under a minute. Whatever you want to say, just try to say it and keep your word. If you do put them on hold, try to keep the hold time definitely less than 2 minutes. Under 60 seconds is optimal. And when you return to the caller, always thank them for holding. That means a lot to them. When you transfer a call, there's a difference between please hold and just transferring them, and a warm transfer, which is before you hand the caller off, let the receiving team member know that you have somebody that is going to get transferred to them. And to say, Dr. Jones, I have Michael, a new patient interested in cataract surgery with questions about premium lenses. In this case, there's not going to be a Dr. Jones. It's going to be something like, Jennifer, I just want to let you know I have Michael, a new patient interested in cataract surgery with questions about premium lenses. I'm going to transfer you now. So that's a big difference between just transferring them or just placing them on hold and transferring them. Don't get too personal on the call, which means, and getting too personal means when somebody just wants to talk about, hey, you remind me of my niece or you remind me of my nephew. We don't want to turn 5-minute calls into 20-minute calls. We want to keep the call concise, short, still give them the attention they deserve, build a connection, but not focus on those things. We don't want to focus on something that's like a squirrel or something that has nothing to do with the call. Every time you spend an extra minute on a call that's not needed is a time you can't spend on a new patient call coming in or a patient in front of you. And again, if a caller does go too long, you're going to say, hey, Miss Mary, all of those are really good questions. Look, I have you scheduled for next Friday at the 12th at 8 a.m. We look forward to seeing you then. Again, if you have any questions or need to change your appointment for any reason, feel free to give me a call. Again, my name is Mary. There's something we use in sales or customer service called a closed-ended question. A closed-ended question is, instead of you just asking the patient when would they like to come in, which could say, we'll just kind of fill this out. Hey, Mary, when would you like to come in? Let me check my schedule. Gosh, I'm really busy that day. Gosh, I'm really busy that day. But if you say, hey, Mary, when would you like to come in? Do Tuesdays or Thursdays work better for you? Oh, probably Thursdays. Great. Mornings or afternoons? Afternoon. Okay. I have a 3 o'clock or a 4 o'clock on the 31st. Would that work for you? Sure. And that helps speed along the caller's decision. And number 2, it helps put patients in slots where we're not overly booked, where we could probably use a few patients. So it's about scheduling. It's about schedule maintenance. And again, it'll save you quite a bit of time on the phone. A really good example of a closed-ended question is when your significant other asks you what you want for dinner. And you're like, I don't care. What do you want? I don't care. What do you want? And then before you know it, it's like 9 o'clock at night and you still don't have dinner. And, it's like, who wants to eat that late? So true story, my wife watched me do phone training at ASOA years ago. And I did this slide similar to it. And she knows I don't like meatloaf. And anytime she'd want to go somewhere, she'd ask me, hey, babe, what do you want for dinner tonight? I can make a meatloaf or we can go to Chili's. Or, hey, babe, what do you want for dinner tonight? We can go to Outback or I can make a meatloaf. And eventually I caught up to it and she was laughing pretty big, but she was laughing hugely. Actually, it took me about 4 times to catch what she was doing. But that's just the perfect example of how you can speed something up by giving somebody 2 options. And you're welcome. Hope this is helpful for your relationship as well as phone training. So we already talked about that slide, helping them choose a decision. Common objections patients might give you and why they won't schedule is, I just want pricing, or I need to think about it. I need to talk to my spouse. I'm just shopping around. Can you just tell me if I'm a candidate? Do you take my insurance, or I'm nervous? An objection is anything that the caller is going to use as a reason not to schedule at that time. So for example, if somebody calls in and they're like, I just want pricing, You say, well, sir, we're not just a LASIK practice. We do all types of vision correction, and LASIK's one type of vision correction, but it can really range. So the first step is to come in for initial consultation so we can find out if you're a good candidate for LASIK, and if not, what procedure would you be a better candidate for? And we also have incredible 0% financing options, because one of the things that our doctors do is they never want finances to get in the way of somebody's vision, especially getting the vision you deserve. So that's one way of talking about that. If somebody needs to find out if they're a candidate, there's no way you can tell them they're a candidate over the phone, right? We can't give medical advice. If they're under 18, we can tell them they're not a candidate for vision correction. If they're 60, we can probably tell them they're going to be a better candidate for refractive lens exchange, just another way of doing early cataract surgery. But with these lenses, most people can see in the distance, up close, intermediate, with little or no dependence on glasses or contacts. Do you take my insurance? That is something you should be able to answer over the phone. And if you can't, say, Mrs. Smith, do you mind if I place you on a brief hold? Let me transfer you to our insurance coordinator, Veronica, and she'll be able to answer all of your questions for you. Then do the warm transfer. Here are some ways to respond to price objections. I understand a lot of patients ask that. The best step is to schedule a quick evaluation so we can give you accurate information on your eyes. My answer was a little bit more real, I think. They need to think about it. Of course, everybody also wants to think about it. We all want to think about it, but they need the extra help of getting in and getting the surgery that they really need. So of course, it would help if we could reserve a time for you now. Then if anything changes, you can just give us a call back and we can get you rescheduled for another time. But at least you have that next step scheduled. Insurance question. Obviously, we can get that for them. We just talked about it. If somebody's nervous or anxious, I understand a lot of patients feel the way you do at first. And I must say, when you come in and you meet the doctors, they can make a big difference and help calm some of your anxiety by answering your questions and letting you know why they're amongst the best surgeons or amongst the leading surgeons in Los Angeles to do that particular procedure. We try to stay away from words like best or pain-free, because those are things that we can't really prove. Pain-free, some people are going to say, itchiness is pain. And we don't want to make any absolute promises like that. Once you schedule the appointment, a way to reduce no-shows is called confirm and commit. So terrific, Maggie. Your reserved time is Monday, September 14th at 8 a.m. at our Burbank office. If anything changes, please just call me back and we can get you scheduled at any time. All right. We look forward to seeing you. That gives them a reason to call back and reschedule versus just not showing up for the appointment. Reserved is a really powerful word. Starbucks uses it for their reserved Starbucks. It makes it feel special. Anytime we get a reservation, it's the same thing. We've reserved this allotted amount of time. We've reserved this amount of time for that particular patient, and it's really important that they know that we've blocked it for them versus, if they don't show up, it's not a big deal. Last impressions matter too. So the last 30 seconds of a call can mean everything to a patient. It can give them a lasting impression until they walk through our door. So make sure that you've answered all of their questions. You've reinstated the next step very clearly. The confirm and commit. You call the caller by their name. You ended it warmly and professionally, where they just felt like, gosh, that place really cares. They listened. And let the caller hang up first. If anybody's ever been on a call with me, it's a really bad habit I have. I'll be on the phone with somebody and all right, thanks, bye. And I've already hung up, and I can hear them as I'm hanging up my phone. Back in the olden days when we had to actually hang them up, I could hear them saying, wait, and then I'd have to call them back. So I've learned to let the caller hang up first sometimes, but that's your job. So make sure that you let them hang up first when it's appropriate, and that'll make them feel again like you've listened to the very, very end. Calls for referring doctors' offices or optometry offices are really high value. So treat them as a high priority. Gather the information from that office very accurately. Make it easy for the referring offices. Don't put them on hold unless it's like, the end of days and you have no other choice. And you want to protect the relationship from the referring practices. We live off doctor referrals and co-management. We don't have a giant marketing budget, so we just want to do our best to make sure that we protect those relationships. Existing patients also need great service. Again, existing patients could be a referral from a doctor's office, or they refer many people. So we want to make sure that we treat the existing patients with the same respect and time commitment as a referring doctor's office or a new patient. But if you had to choose, it goes referring doctor, then triage, referring doctor, new patient, and then existing patient. Today's patient is tomorrow's surgical candidate. So just also remember that they may come in today for a cataract evaluation or a LASIK evaluation. Maybe they're not a good candidate, but they're going to come back if they had a good experience with our practice when they do need surgery. Your main goals for every call is going to be answer within a few rings, use the approved greeting, let them hear your smile, guide them towards scheduling, get them converted if you can. Make sure you always ask them to come in for an appointment. That'll be a major fail if you don't. Confirm and commit before ending the call. That's when you're saying the reserved time, right? Reserved your appointment for Tuesday the 12th at 8 a.m. We look forward to seeing you then. Again, if anything changes, my name is Paul, and just call us back. We'll get you rescheduled and get them scheduled for an appointment. Everything about this call is get them scheduled for an appointment after answering the phone. You got to answer the phone to get them scheduled for an appointment. Don't let the phone go to voicemail. I don't even think we have voicemail. Don't let it ring and ring and ring. So obviously, if we're receiving 10,000 plus calls a month and we're missing 12 to 14%, that's over 1,000 missed calls a month that we're just not picking up. Your main goals on every call we've already talked about, and what we'll be measuring is how fast you answer the call. What is the missed call rate? What is the new patient conversion rate? Refractive lead conversion. This is if the call gets transferred to a surgical counselor, how well did the surgical counselor get the patient? How well did they do at getting the patient in the door? This call is not really about that. That's another call for another time. What was the hold rate? What was the amount of abandoned calls where the call dropped, and the response to referring doctors? We're going to be listening to calls and kind of giving everybody a report card, so to speak. And these report cards will go over some of these metrics. So you want to make sure that you're doing the best that you can. Definitely role play. I know role play is not something that everybody likes to do with a fellow employee, talking, getting into character and talking, pretending you're a cataract patient or pretending you are a LASIK patient, going through objections. But if you practice at this, you're going to get better at overcoming objections. One thing we're working on is a role-playing avatar where you can actually talk to an AI agent and they'll pretend they're a patient. They'll give you various objections, and then you can practice converting that patient over and over until it just becomes natural. It could be something that just is thrown at you, such as, do you help with Fuchs dystrophy? If you don't know the answer to that, find out. And then when you're in role-playing, and that question comes along again, oh, absolutely, we treat Fuchs dystrophy. We're one of the first practices in LA to do DSEC and DMEC. We have a cornea specialist here, which is the part of the eye that we treat during DSEC treatment, when we do Fuchs dystrophy treatment. So the more you do this, the better you're going to get. I probably need to go back and do that last bit about DSEC, but I'm on a time crunch. I want to get this done in under an hour. Every call matters. So be warm, clear, confident, efficient, helpful, and always ask for the appointment. I've said that multiple times. Answer the phone. Always ask them to come in for an appointment. Really, really important. The impact of the word absolutely is pretty important. Again, we talked about the brain cloud scenario, but also, pretend it's cancer. You call, an oncologist that specializes in a certain type of cancer. You ask them if they treat that type of cancer and they say, yes. Well, that's not very good. You want them saying, absolutely, you definitely called the right place. That's going to make you feel confident, reassured, and satisfied that you called the right place. Another thing is not saying no problem. Learn from Chick-fil-A. They've replaced no problem with it's my pleasure. That means you're not bothering me by asking me to do something for you, but I'm getting actual pleasure out of helping you. Later in life, that's what it's all about, is helping other people. And that's where true happiness, I think, comes in, is when you're able to help other people, have a better life, have a better experience. And it's a big word, it's my pleasure, and absolutely. Now, we're going to wrap up here. Let's see what you learned. You can go to thinkdenali.com/phone-training-for-ophthalmology-practices, or you can just scan this QR code. When you scan the QR code, it's going to take you to a list of maybe 10 multiple choice questions. You're going to enter your name, the practice name, and your email address, and take those questions. They're very easy. Just want to make sure that you were able to listen to this presentation and understand it. And it also helps us keep track of who actually watched it. So it should take you less than 5 minutes to do that. And since we're not doing a live phone training session, there can't be any questions. But thank you for your time. Thank you for your attention. And let's really fix the phones, convert more callers to patients than ever before. And what can happen is for the patients. If you have any questions, though, you can reach out to me at paul@thinkdenali.com, or you can call me at 682-831-0900. Thank you for watching.